Hello everyone, and welcome back to this channel again. My name is Nurse O, and in this video today I will be discussing about caregiver job in Canada, especially for new immigrants. So there are different jobs you can do as a new immigrant to Canada. You can work in store, you can work as healthcare assistant, you can work as caregiver, personal support worker, depending on what each province call them, pending the time you get your certifications or your licenses. So if you're planning to work as a caregiver, here is what you need to know. The first thing is you need to apply on different job search platforms such as Indeed. That's the commonest one I know. So you can search for healthcare assistant job, you can search for personal support worker job, but the requirements sometimes vary depending on employer to employer. There are some employers that will really request you to provide certification in healthcare assistant. That means you have to go to school for possibly like 8 weeks or 3 months, depending on the school you are applying to for that course. And at the same time, there are some employers that will just take you as a foreign nurse. I'm not saying it's only nurses that can work as caregiver. Anyone can work as caregiver, whether you're a doctor, you are an accountant, a nurse, anybody can work as a caregiver, because basically they will be giving you orientation before you commence this job. So, but for nurses in particular, if you are a nurse from your country, there is every tendency that you might not need to go back to school for this course, because you know it doesn't worth it being a registered nurse from your country and they are still sending you back to go and do a more inferior course. You know, it's really not worth it. So sometimes you might be fortunate to find some employers that might not request for certification in healthcare assistance. In my own case, I remember when I got employed as healthcare assistant, what my employer did then was just kind of equivalent. They tried to match my credential, my education to the standard in Canada. So I only applied with Alberta Health Directory that time, so which means my employer only forwarded my competencies, my skills, everything to Alberta HCA Directory, because they have a body that controls all healthcare assistants. They want to have a kind of registry so that everybody can be under supervision, under a kind of role, so that they can know the actual amount of healthcare assistant they have in that province. Although that is for Alberta where I reside. I don't know what happens in other provinces, whether they try to match your education from your country, your work experiences, to the equivalence in Canada standard. But for Alberta, that was what I actually did. So a lot of time employer will not ask you to provide certification in healthcare assistant field as a nurse. So that is basically the requirement. In short, you might need the certification and you might not need. And after being employed, you can actually work in different facilities. You can choose to work in hospital, you can choose to work in long-term care homes, you can choose to work in nursing home, you can choose to work in retirement home, you can choose to work in client home, I mean individual home. So it depends on your choice. In my own case, I work as a personal support worker. That means I need to move from different home to home. So on my schedule, they might have given me like 5 residents that I will have to see for that week. So sometimes I might work in one house for 3 hours. Sometimes I might work in another person's house for 6 hours, sometimes 8 hours, 12 hours, depending on your agreement when you were initially employed. So if you choose to work as a personal support worker in home, your job description will quite be different from somebody working in hospital or somebody working in long-term care homes. So for somebody working in a client's home, there are basic things they will need you to do. Number one thing is vulnerable sector check. They want to see your character, whether you've committed offenses before they can employ you. So sometimes employer will ask you for a very recent vulnerable sector check, which is no more than 3 months, sometimes 6 months. It all depends on individual employer. Another thing that you might be required for, because you're working in home, is your rubella test. They want to see whether you have immunity against rubella and measles. Also, sometimes they want you to provide negative screening tests for tuberculosis, because here there's no tuberculosis disease, and they don't want people coming from outside to bring in this virus to their citizen. So because of that, you have to provide, either you are doing the skin test or you are doing the chest x-ray, which has to be recent. Sometimes employer will ask for within 12 months, and sometimes some, if it is chest x-ray, they still take like 2 years from you, which means you have to do all of these tests. Also, if you are working in homes, there are basic responsibilities you have to do for your clients. Number one, you might be requested to be doing cooking, not major cooking, like just to make omelette, just to do toast for them. You can just give them muffin, just microwave it for a few seconds, give it to them, give them water, snacks, which is quite almost the same with you working in facility. But you know, in facility, the kitchen will already prepare the meal, you are just serving your residents. But in home, you will be the one to prepare, and you, of course, you know, all the plates you are using, you have to wash them. Then sometimes you have to do some house cleaning, light house cleaning. You can do laundry for them. You're not washing with your hand, but you're gonna use the machine to wash and to dry, then fold those clothes back for your clients, because a lot of time these clients are unable to perform all of these house chores. Then another thing you might be required to do is to take them for shopping. Some of them have their own personal cars, but they cannot drive, and some employers will even ask you before they employ you whether you have driver's license and the car, because part of their services is you have to carry their resident to for shopping with your own personal car. So all of this you have to have you must have discussed it before they employ you. So sometimes you might be required to take your clients to stores for shopping. Then sometimes you might have to take them for their medical appointment. Sometimes you have to take them to field for little exercises. So when you are working in home, your responsibility is quite different from when you are working in a facility like retirement home, nursing homes, hospitals. So you have to actually know your responsibilities. I remember there was an experience I had when I was working as personal support worker, because when I was employed, they will give you your job description. So I got to this client home that very day, and the man insisted that I need to wash the washroom, like wash the toilet, which I have never done before because it's not my responsibility. Like, my employer made it clear to me that I'm not supposed to do cleaning, like no cleaning whatsoever, no laundry. So this guy insisted and I refused. So at the end of the day, the wife came down from upstairs and started yelling at me like, if you're not able to do the cleaning, then why are you here? I said, I am here just to watch your husband for 3 hours, just to make sure he's safe when you are relaxing upstairs. And this woman flared up at me, said, if I cannot do it, then I need to leave. And you know, this is Canada. It is an instruction. I left that home and I called my employer. So my employer had to tell me that it's not my responsibility. So they had to pull me out from that client's home because, you know, I'm already at risk. They don't like me, like, kind of, because I refuse to perform that task. So when you are getting employment, please always clarify your job description before you take them up, so that by the time you get to the field, you know what you're supposed to do and what you're not supposed to do. Then another responsibility you might likely be doing when you are in client's home is to give medication. Although it's unusual, but sometimes there are some employers that will give you medication training. Or, you know, we are all nurses, we know what to do. But if you are not licensed, my dear, you cannot do medication administration. But you know, you are working in home and they feel that this client, a lot of time, they are having dementia, so they might not be able to do all of these things by themselves. They might take morning medication lately. They might even pop morning and evening medication together. So because they don't want all of this to happen, that is why you are there. So you need to really make sure that you give medication administration based on the teaching you've had. And that is if you are working in home. So if you are working in hospital, the responsibility is a little bit different. You know, like, you have to get up your patients up in time, do a little cleaning for them, as well as if you are working in a long-term care setting. Almost all the responsibilities lies on you, and that is why you need to choose the setting where you intend to work carefully. In my own case, I wasn't willing to do a lot of stressful job, and that is why I had to opt for home care. So that is basically what I did. So in terms of the job pay, let's talk about that one. You know, I know that will be your main area of interest. Of course, I will say the minimum amount that you can get working as an healthcare assistant is between $18 and possibly $22. Although it depends on your employer, and it also depends on the kind of job you pick up. If you're working as an employee, you might likely be getting between 18 and 22, or let's say maximum of $24 per hour. But if you choose to work as an agency healthcare assistant, this means that you might likely be taken to far area from town. You might be working in rural areas, and because of that, there are some other additional benefits you might be getting, like your transportation, your mileage. If you're using your personal car, you'll be claiming mileage based on each kilometer you cover. And at the same time, sometimes employer will pay you your meal allowance. Depending on how many hours, they can pay you $20 per hour, they can pay you $50 per hour. It all depends on the contract. But the danger in working as an agency a lot of time is this. Remember, if you are working as an employee, you will surely belong to an association. But if you are working as an employee, my dear, you are on your own, which means if you encounter any problem, if they lie against you, remember you are just coming as a new immigrant, and possibly you don't know anyone, you don't know any lawyer, and you are not also in any association. If resident claimed possibly that you harassed them or you handle them roughly, you know, in our country, the way we just roll our patients and they don't react to it, it reverses the case here, which means you have to really handle them gently. They don't want you to just roll them anyhow. You need to inform them like, this is what I'm about doing for you, so that they will be well informed. Otherwise, they can just rope everything back on you, and because you're working as an agency, you're on your own. Immediately any problem happens, I can assure you that your employer will not do nothing. So which means you have to be very careful in your selection of job offer. I will not discourage anyone not to work as an agency staff, but that is just basically the danger, that if anything happens, you're on your own. So for pay rate for anyone working as an agency staff, you can expect between $25 and $30, or maybe $32. And by the time they had your mileage, your feeding allowance, you might be getting up to $40 per hour. This also depends on each province. Okay, if you are working in province like Ontario, you might be getting like $35-$40 per hour. But if you are working in my province, you can just be getting between $25, $28, $30, or maximum of $35. So it all depends on the province. And the payday is usually every 2 weeks you get your payment. And of course, you need to file tax. Then another thing I need to quickly talk about, that people are always asking me, that if I'm working as a healthcare assistant, is the pay sufficient for me to live a very good life? Well, I will not say yes and I will not say no, because the way we spend is quite different from each other. I can say this boldly, like things are even getting more better, because when I was employed, I was getting $17 per hour. Some people will tell you that when they were employed, then they were getting $11, $10, and they still survived. So it all depends on how much work you do. Minimum of 40 hours per week is what you're expected to do, which means if you do anything above 40 hours, your tax will definitely be high. Like, they will charge you normal taxes if your hour is within normal 40 hours. But anything you do outside of 40 hours is just like you are wasting your time for government. You are just working for government, because the tax at that time will be 50-50. So just be informed. What you can do in that situation is, if you have high energy and you really want to work hard, you just have to work for 2 employers, so that your taxes will just be within normal. Okay, and that is for that question. So which means working as healthcare assistant, you can still live a good life. you look for a very small house. You know, you are a new immigrant, you don't know anyone, so why should you be looking for 2-bedroom apartment if you are single? And if you are married, you can as well look for, there are some houses they call condos here, like it's a very small house, still like 1 bedroom or 2-bedroom apartment. You can get that one temporarily, and you can just be using that one to manage life pending the time you get your certifications, you get your licenses to begin a very more professional job. And also, if you migrate to Canada with your family, especially for those who have children or possibly just a child and is still underage, you will need to plan yourself accordingly, especially if you choose to work as a caregiver, either both the husband and the wife, because here in Canada it's pretty different from our country, where you can just drop your child anyhow. You can just tell your neighbor that please just help me look over my child. No, it's different here, because the case here is there are certain ages that you cannot just leave your child all alone by themselves at home. Although there's no legal age in Canada for any child to be left all by him or herself. But for instance, in New Brunswick and Manitoba, before you can leave a child all by themselves, they have to be of age 12. But for other provinces, there is no actual age for any child to be left at home. But the thing is, if you are leaving a child, say maybe 8 years or 10 years, and possibly the 2 kids or 3 kids at home, they get into fights one day and they begin to yell, scream, shout, and the neighbor just hear their noise, they can immediately call the child welfare case worker. And these people, once they come in, they have to do some underground investigation to really know whether you have always been leaving your child or children all by themselves. They will consider the age of these children. They want to see their knowledge, their level of intelligence, because the most important thing to these people is your child safety. So if they notice that your child safety has been endangered in any way, that will be considered as neglect. And if care is not taken, they might take these children away from you for few months, years, or maybe forever. I'm not trying to scare you, but that is what is operating in Canada, which means when you come in with your family, especially both husband and the wife with your children, and you intend to work as husband and wife, you need to really figure out how you're gonna do it so that there will be no time you will leave your children, especially if they are underage, all by themselves at home. So, and lastly, working in Canada as a caregiver requires you to be very patient, because Canada has zero tolerance for any form of abuse or any kind of abuse, whether verbal or physical. So by the time you get to your place of work, you will surely encounter some funny clients sometimes, that they will yell at you, they will shout at you, they will refuse you giving care to them. So all you just need to do is just to document the incident and inform your employer so that they can take appropriate steps. So this will be the end of this video. Please, if you enjoy watching this channel, don't forget to subscribe to it, give it a thumbs up, and don't forget to hit the notification bell so you get notified every time I drop a new video. Thank you so much, and I appreciate you all.